Dental cavities and gum diseases are very common. According to the World Health Organization, between 60 and 90% of school children have at least one form of dental cavity. A recent study has shown that 37% of children who had experienced oral pain in the last 12 months had not taken part in an activity at school because of their teeth, and this shows that the quality of a child's oral care could have an impact, thereby limiting his or her potentials and self-esteem. As the world marked the Oral Health Day, this team of professionals stepped out there, moving from school to school within the Kintampo North Municipality of the Bono East region to educate students through proper mouthwashing methods. Mr. Douglas Avoka is the president of the Oral Health Professionals Association of Ghana.
We're actually celebrating World Oral Health Day. Today, actually at Apesika. What we are doing now is currently to talk to school children because we understand statistics available now indicates that about 486 million children suffer from various dental problems, and that is very serious. And because of that, about 50 million school hours are lost. And we see that it's affecting so much of education. So because of that, the association has decided at this time, for the World Oral Health, they will zoom to the schools, especially to the rural areas where access to dental care is actually, they see it as a luxury rather than a basic need. So we are deciding to zoom actually into the schools, and that is exactly what we are doing.
The team undertook 3 different major activities, and this includes
we're actually distributing toothbrushes and pastes to the students, kind courtesy Unilever Ghana, and we are teaching them how to brush their teeth also, and taking their concerns, and actually also referring those who have problems. We have mounted an outreach point just behind us here. We are referring those that have problems over there to be treated free of charge. So I think basically that is the reason why we are here.
Mr. Avoka had one key observation throughout his encounter with the students.
I observed so seriously that all the schools we went to, actually we visited about 9 basic schools. And out of those, yes, the number of schools we visited, we realized that not a single one of the people had visited a dental clinic before, and that's very serious. Yes, so you look at their ages and none of them visited a dental clinic before. Is very serious.
Dr. Israel Patkwan Gamba is the head of the Oral Health Department at the Kintampo College of Health and Wellbeing. He expresses worry at the low rate of oral health facilities across the country.
As a country, I think that in a way we have not really taken oral health serious, which is really worrying, because I'm looking at distribution of oral health facilities in the country. I would have wished that we're in 2019, at least policymakers would have made things available. At least every district hospital should have had a dental chair, and probably a dentist or one of the middle cadres, either a dental therapist or a registered dental assistant, manning some of these facilities. But that is not what we really see. But I believe that as the Director General took a step, I'm hoping and praying that it will be implemented in the nearest future.
He appealed to authorities to engage professionals sitting home as a means to improving oral health across the country.
Going forward, I want to just plead with those who matter, especially the Minister of Health, the Director General, and the Minister of Finance, because we've had a lot of our students still sitting in the house, which I believe that if they are given clearance, they could enter into various hinterlands to give back to the society. So that is what I will entreat to the policymakers to do for us.
Some of the students and teachers of the Apesika DA Basic School shared with Joy News what they learned from the encounter.
I'm happy they came here. First, we were not brushing our teeth well, but since they came here, we have now seen how to brush our teeth and how many times we will brush our teeth. So I'm happy to see them again.
Since let me name how many times I saw brush with it, but now man said they be and I saw brush with it 2 times. ɛna sɛ wodi so na adwane kɔ nsima yɛ sɛ wodi nsuo gu wɔn na wɔyɛ bet ɛnu kwan so ɔdi nnua ɛna ebe yi ti no I've got to know this.
Many of us today have learned how to brush our teeth, the number of times we should brush, and the way we should brush. We shouldn't swallow the substance when we are brushing, because it may carry some germs which may have adverse effects. And we wish that we will continue to get them always for this education.
The good news to the people of Apesika is that whilst the students were taken through proper mouth-washing procedures, their parents received free dental screening and care. Reporting for Joy News, Anas Sabit, Apesika.